The state of Georgia just saw its second deadliest day of this pandemic. 78 more deaths were reported Tuesday as cases are climbing steadily along with hospital admissions. And with the virus spreading through the state, different cities have to forge their own path, which has led Savannah to team up with New York State. Earlier this week, you might recall, Governor Cuomo flew there to meet with the mayor. Through this partnership, New York is helping Savannah set up testing sites and providing equipment like gowns, face masks, and testing kits. Joining me now is the mayor of Savannah, Van Johnson, a Democrat. Good to see you, Mr. Mayor. First, I want to ask you, as you see cases and hospital admissions climbing in this state, how worried are you about the wrong trajectory, frankly?
I'm extremely concerned. All of our data points show that we're heading in the wrong direction. For us as a city that only has about 150,000 people, but we have thousands of visitors that come from around the country, this is very distressing to us.
Yeah, one of the most beautiful cities, in my opinion, in America, and a destination for so many people. So talk about what is the crux of this new partnership with New York and why the interest, frankly, from Governor Cuomo in Savannah specifically.
Well, we were blessed to be noticed. I am a native New Yorker by birth. And so I had some familiarity with what was going on in New York. My parents are still in New York. And the governor and his team took notice of what was happening here in Savannah. We have forged a wonderful partnership. The governor and his team were here earlier this week. They brought over 165,000 items of PPE. Our population is about 150,000. More importantly, we had an opportunity to learn from winners. When you want to win, you hook up with winners. And New York has shown the country how to look coronavirus in the eye and successfully win. We want to know how to do that too. If New York can do it, Savannah can do it too.
So the governor helped set up new testing sites in your city, but we have seen that test results increasingly are delayed in states across the country. And frankly, it's very easy where I live here in New York City to get tested, not so easy to get results back quickly. So I guess, first of all, how much of an impact do you expect these new testing sites to have overall? And will that be diminished by the fact that, frankly, most places can't get results back fast enough? Do you have a plan in place to address that?
Well, it is a two-edged sword. One issue that we're working with our Coastal Health District in terms of helping to get tests processed. But we also know in order to isolate, to be able to identify where this virus is, where the hotspots are, we have to do testing. So on one end of it, we have people on the ground here from New York, which will be here for the next couple of weeks, and we're testing. We're trying to do 500 at least a day. In addition to the testing we're doing with our health district. And then we're trying to find alternative ways to make sure that we get this processing done quickly so that we're able to know within a very reasonable period of time whether people are negative or not, or whether they're positive. People need to know.
So how difficult are you finding that to be? As you well know, Mr. Mayor, months ago, back in March and April, there was a call for the president to get the federal government involved to make sure that PPE was available, to make sure that the tests were available, to make sure that companies were ramping up to process those tests. How much of a struggle has it been for you to find a place that can get your test results back to you quickly?
Well, I think that's going to be in the history of how we as a nation has handled this pandemic. The reality is we all really just needed a consistent plan of action to be coordinated in what we do, that our federal government and our state governments are talking in the same voice and our local governments are speaking in the same voice. We know that has not happened. And so therefore, on the ground where people live, in Savannah streets, people are extremely confused. And so for us, our role is to be able to take it one piece at a time, to be able to look at best practices, to be able to connect with people who have done it well, and to be able to eliminate barriers by working with our health community, our faith community, and our community as a whole, to have people understand how serious of an issue this is that we face.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.